Let's start with anatomical position. Anatomical position is the standard reference position of the human body. All anatomical descriptions are made according to this position, irrespective of the actual posture of the body. Even if a person is lying down or sitting, structures are described assuming the body is in anatomical position. In anatomical position, the person is standing erect. The head is straight and eyes are facing forward. The upper limbs are placed by the side of the body. The palms are facing forward. The lower limbs are together and the feet are pointing forward. Anatomical position provides uniformity and clarity. For example, when we say the heart is on the left side, it is according to anatomical position. Without a standard reference, describing the human body would be confusing and inaccurate.
Now let's study about our next topic, which is anatomical planes. To study the human body properly, we imagine certain flat surfaces passing through it. These imaginary flat surfaces are called anatomical planes. They divide the body into parts and help in understanding structure, movement, and radiological images. The four types of anatomical planes are sagittal plane, oblique plane, frontal plane, and transverse plane.
Let's start with sagittal plane. A sagittal plane divides the body into right and left parts. When the plane passes exactly through the midline, it is called the median plane. When it passes parallel to the midline, it is called a parasagittal plane. Sagittal planes are important for studying symmetry of the body. Coronal plane, also known as frontal plane. A coronal plane divides the body into an anterior part and a posterior part. In simple words, it separates the front of the body from the back. This plane is commonly used while studying the chest and brain.
Transverse plane. A transverse plane divides the body into an upper part and a lower part. It is also known as the horizontal plane. CT scans and MRI images are often studied using transverse sections.
Now it's time for the last topic of our video, which is anatomical terms. Anatomical terms are used to describe the location and direction of structures. All these terms are described with reference to the anatomical position. Using correct terms is extremely important in anatomy, surgery, and radiology.
Anterior and posterior. Anterior means towards the front of the body. Posterior means towards the back of the body. For example, the sternum is anterior to the heart, and the vertebral column is posterior to the heart.
Superior and inferior. Superior means towards the head end. Inferior means towards the feet. For example, the brain is superior to the heart, and the stomach is inferior to the lungs. Medial and lateral. Medial means nearer to the midline of the body. Lateral means away from the midline. For example, the nose is medial to the eyes, and the ears are lateral to the eyes.
Proximal means nearer to the trunk or point of origin. Distal means farther from the trunk. For example, the elbow is proximal to the wrist, and the fingers are distal to the elbow. These terms are mainly used for limbs.
Superficial and deep. Superficial means nearer to the surface of the body. Deep means away from the surface. Example, the skin is superficial to muscles. Bones are deep to muscles. So this was a clear overview of the anatomical position, anatomical planes, and anatomical terms, which form the foundation of general anatomy. Understanding these concepts will make learning anatomy, radiology, and clinical subjects much easier. At the end of this video, there are some practice questions for you. Try to answer those questions in comments section. I will post correct answers in description box. Thank you for watching.